Welcome to the second quarter 2024 Indiana FADS education webinar on the self-audit. This webinar helps to explain the purpose of a self-audit and the steps required by providers when a self-audit notification letter is received from the Family and Social Services Association, or FSSA. This webinar is being sponsored by the Office of Medicaid Policy and Planning, or OMPP, with contributions from Patricia Hansroth and Kelsey Oren. By the end of this webinar, you should be able to define the purpose of a self-audit, highlight key CMS and IHCP regulations for self-audit, review key differences in self-audit and self-disclosure, discuss the steps of the self-audit medical chart review, complete the self-audit attachment A, and identify common self-audit errors and prevention. Typically, self-audits are one of the key elements of a healthcare provider's compliance plan. Within this process, it allows providers to review their internal controls to identify any issues with their billing, coding, and can potentially avoid both overpayments and underpayments. CMS guidelines state that claim and medical chart review self-audits are the review of claims and medical records for compliance with applicable coding, billing, and documentation requirements, ideally to include the person in charge of billing and a medically trained person. For example, a self-audit could be conducted by a registered nurse or physician. A self-audit examines and reviews an organization's processes and procedures performed both by and within a given physician's or other healthcare professional's practice or business. In other words, a self-audit is audit work that the entity does for itself. Self-audit evaluates that the services billed to Indiana Medicaid are both supported by documentation and adhere to federal and state Medicaid policies. In addition, the self-audit process helps to assess, correct, and enhance overall efficiency by identifying areas of improvement. The Office of Inspector General, or OIG, believes that the great majority of physicians are honest and share the goal of protecting the integrity of Medicare and other federal healthcare programs such as Medicaid. To that end, it is the responsibility of all healthcare providers to ensure that all claims submitted to federal healthcare programs are truthful and accurate. The guidance from the OIG emphasizes a step-by-step approach to follow in developing and implementing a voluntary compliance program or plan. A sound self-audit compliance plan can reduce improper payments, including overpayments and underpayments, lower the chances of an external audit by proactively identifying any issues with claim submission or documentation problems, improves overall patient care by identifying and addressing gaps in service delivery and clinical processes. And lastly, it can ensure that staff are well trained in compliance requirements and foster collaboration. Let's review the regulations from both CMS and Indiana as they pertain to self-audits. The federal government oversees state Medicaid programs because it provides a portion of the funding, with states also contributing their own funds to this program. This is done with the Code of Federal Regulations, which are rules and regulations that are designed to ensure that state Medicaid agencies are appropriately and efficiently following the regulations in a manner that is cost-effective. They also must ensure the delivery of services are medically necessary, are provided in the most appropriate setting, and conform to quality standards. These regulations are broken into three areas. First, authorizes statewide utilization control units to monitor the Medicaid program, including conducting post-payment medical chart reviews. Next, requires states to have processes and procedures in place to ensure Medicaid dollars are being used properly and the program is operating efficiently. And finally, establishes the external procedures detailing the agency's requirements from providers concerning the appropriateness and quality of Medicaid services. At the state level, OMPP depends on providers to assist in the identification and resolution of documentation and coding matters that adversely affect IHCP. It also believes that a cooperative effort in this area will serve our common interest of protecting the financial integrity of the IHCP and ensuring proper payments to providers. If the IHCP, after investigation or audit, finds either of the following: an inaccurate description of services or an inaccurate usage of procedure codes, revenue codes, and modifiers, the OMPP will notify the provider of the error. Providers can ensure timely compliance with IHCP policies by reviewing bulletins through June 13th of 2023 and banners. Providers can also sign up for email and or text notices of Medicaid and other Family and Social Services Administration, or FSSA, news, reminders, and other essential information. When we talk about both self-audits and self-disclosures, there is a bit of confusion. So let's compare and contrast. Although these processes are similar, there are some distinct differences. A self-audit is an examination or review performed both by and within a given provider's office or business on their own processes, procedures, and internal controls as it relates to claim and medical record processes. Indiana FADS will initiate the self-audit process by sending the provider a certified letter by mail notifying the provider that they have been selected for a self-audit review of medical records. A self-audit is completed by the provider, giving them the opportunity to review the claims in question and provide supporting documentation associated with the billing of these services. Both self-audits and post-payment audits encompass a comprehensive review of records to detect errors and provide valuable insights aimed at mitigating future inaccuracies. Self-disclosure is defined as the process that enables Medicaid providers to notify IHCP of any inappropriate Medicaid payments. The self-disclosure process is a process that enables Medicaid providers to notify IHCP of any inappropriate Medicaid payments that they have received and pay them back. In a self-disclosure, the provider discovers inappropriate payments. Once the improper payments have been identified by the provider, they self-disclose the information to IHCP. Keep in mind that both processes aim to identify, rectify, and mitigate potential compliance violations specific to medical record documentation. What documentation can providers anticipate receiving as part of self-audits? Let's look at the self-audit documents and review the process. The provider will receive the self-audit notification letter that resembles the post-payment letter that you may have received in the past. On page 1, you will notice that the main difference is the RE line states Self-Audit Notification, or SAN. You will also notice on page 1 the paragraph that identifies the self-audit focus. This delineates the focus of the self-audit, detailing the analysis of a particular claim type and the corresponding IHCP policy. It also includes references to Attachment A, which contains the claims and members selected for the self-audit review. On page 2, you will find the self-audit process. This page includes what OMPP is requesting of the provider to complete the self-audit process, including reviewing each claim line determination on Attachment A and submitting the medical record documentation supporting the claim. You will also receive Attachment A with the claims and members included in the audit, and Attachment B, which outlines the instructions for completing the self-audit process. Let's take a closer look at the Attachment A. Along with the SAN letter, you will receive an Attachment A form. This form resembles the post-payment Attachment A form, as it includes a comprehensive list of claim numbers, member IDs, beneficiary names, procedure codes, service dates, and total claim paid amounts. The key difference is that it also has an additional column labeled Agree, Disagree. The provider is required to fill out this column by indicating if they agree or disagree with the claim line. Now we can look closer at the instructions included in Attachment B. Attachment B includes the instructions on how to complete the self-audit. These instructions provide the step-by-step process for the review of each claim line found in Attachment A. Specifically, you as the provider are asked to review the medical records for the claims listed in Attachment A. For this review, you will determine if the claim was billed appropriately and was supported in the medical record. If you believe the claim was both supported in the medical record and billed appropriately, you will enter Disagree in Attachment A for that claim line. This indicates to ICHP that the claim was compliant with the IHCP policy. Medical records are to be submitted for these claim lines, and you must provide a case-by-case explanation. For your convenience, a separate page is included with the SAN letter to provide these case-specific explanations. If you believe the claim was not supported in the medical record or billed incorrectly, you will enter Agree. This indicates to the state that you believe the claim was not compliant with IHCP policy. Attachment B also includes the timeline to complete and return the Attachment A, corrective action instructions, information on adjustment or voiding of claims on Attachment A, contact information for questions, and a place for case-by-case explanations. Just to make the process clear, let's review the step-by-step process for completing a self-audit. Now that you understand the documents that you will receive, let's review the steps you will complete in the self-audit process. Step 1. The provider should thoroughly review the documentation received from OMPP, including the SAN letter, Attachment A, and Attachment B. Step 2. Identify the due date for documentation submission to OMPP, which is 45 days from the day that you receive the letter from UPS. Step 3. Make sure the medical records collected for the submission are complete. For example, the documentation should include any treatment plans, orders, or other supporting documentation. Step 4. Verify that the documentation is legible and inclusive of all dates and records requested. This should include the patient identifiers and the date of service on each page of the documentation. Step 5. Enter Agree or Disagree on the Attachment A and include the case-by-case explanation for any line that you indicate disagree. Step 6. Include the name and telephone number of the contact person for the request. And finally, Step 7. Upload the documents to the SFTP portal. Let's look at the right way to complete the self-audit. In this example, the provider completed the Agree or Disagree column of Attachment A based on entering Agree for claims that are non-compliant with IHCP policy and Disagree for claims that are compliant with IHCP policy. This provider also included supporting documentation to explain their findings. The provider included the name, telephone number, and email of the contact person for the request. This will allow OMPP to address any questions they may have. The provider uploaded the filled-out Attachment A and supporting documentation, such as treatment plans, orders, and progress notes, to the SFTP portal. Instructions on how to upload documents to the portal are provided in the SAN letter. The OMPP can now complete their review of the information and make a determination. Let's look at an example done the wrong way. Some common issues OMPP has identified regarding providers submitting documentation for review are: the Agree-Disagree section of the Attachment A form is blank. This section of the Attachment A form must be completed. This information is essential for OMPP to understand the provider's responses to the requested self-audit claims. The supporting documents aren't uploaded to SFTP. If the provider believes that the claim submission was compliant with IHCP policy, the provider must upload supporting documentation to show that services were rendered appropriately. If no documentation is received to support the disagreement, the claim line will be denied. In contrast, if the wrong supporting documents are uploaded to SFTP with the Attachment A form, the OMPP will also deny that claim. Finally, the provider didn't include the contact information of the individual that OMPP can contact to ask questions, or the incorrect person is listed as the contact. This submission isn't done the right way, it will be denied by OMPP. Let's wrap up. In summary, there are several key takeaways. Self-audits are part of a provider's compliance plan. The self-audit process enhances efficiencies by identifying areas of improvement. CMS and Indiana have regulations for self-audits. Self-audit and self-disclosure are not the same, but both aim to identify, rectify, and mitigate potential compliance violations. Self-audit information and process steps for completion are outlined in the Self-Audit Notification Letter, and the IHCP website provides information related to policies, bulletins, and banners so you can stay up to date. You can learn more about self-audit by reviewing these references, which can be accessed in the PDF version of this presentation, which is available by accessing the URL on the next slide. The Program Integrity Team has a provider education website where you can access additional training to keep yourself up to date on the latest information. See the URL at the bottom of the slide. Thank you for attending this session. If you have any questions, please email the Program Integrity email address listed here.